Just talking about any specific questions that you guys have for me.
Can we get cards?
Yeah, I do have toothbrushes and flyers and bags made up for everybody. So inshallah, I'll have the team pass them out here after I'm done.
मैंने 2 साल पहले पाकिस्तान में ब्रिज वाला करवाया था
जी।
आई एम डेप्यूटी तो वो खैर लेकर मैं आ गई यहाँ मैंने लगाया अभी कुछ दिन लगाया 10-15 दिन उतार देती थी रात को तो मुझे लगा यहाँ मेरी गिल्टी बन गई यहाँ पे बहुत डॉक्टरों को दिखाया उन्होंने वेप्सी वगैरह की सब क्लियर था लेकिन मैंने छोड़ दिया डर के मारे यूज करना तो क्या हो जाती क्या उसकी वजह से ये जो ब्रिज बना था उसकी वजह से हुई थी वो गिल्टी या किस वजह से हुई थी
तो यहाँ नीचे आपके
यहाँ पे
तो उससे जो है maybe there is something else going on.
गम्स
गम्स में नहीं आपके salivary glands नीचे ये जो है ये chin के नीचे जो है is your salivary glands. So if something goes into your saliva and gets into the gland like your ducts, कुछ ना कुछ maybe got inflammation there, तो वो भी वो हो सकता है.
दांत तो गए थे सब सही है.
Yeah.
Second question, which toothpaste is best for our?
Okay, what toothpaste is best? Of course, that's important, right? Right. So when elderly patients come in, usually they come in with some sensitivity. They have recession of the gums, right? The gums went down. They have recession because the bone goes down and the gums go down. That happens over time. That's part of aging. So yeah, Sensodyne is good for elderly. Usually I say anything that is approved by the ADA. The ADA, American Dental Association, usually they'll stamp it and you can buy that. Colgate, Crest, they're all good. Just double check. Whatever you feel is good for you, a Sensodyne or a sensitive toothpaste is usually probably best.
What about Ames?
I'm sorry?
Ames toothpaste.
Ames.
Ames?
AIMS.
Okay. Is that, okay, is that a little bit, I'm not familiar with Ames.
But I'm using that, okay?
Okay,
One
It's
thing.
organic though. It came originally. It's like organic.
it's an organic toothpaste, okay.
What about this mouthwash? How to cure it?
Do we need to use mouthwash?
Mouthwash.
Yes,
You are telling about mouthwash.
yes.
How to get it better?
Which one's better?
Uh,
So which
When-
which mouthwash is better? Or how does that improve
How
your
to
mouth?
use it?
How do we use it?
Yeah.
So mouthwash again, very similar. There's so many out there on the, if you go to the Myers or Walmart, you see so many different mouthwashes, right? What do we get? I don't know. I'm confused. So
I'm
you
sorry,
just-
sorry. About mouth dry mouth.
Dry mouth.
Oh, the dry mouth.
Sorry,
Okay. Yes. The best mouth rinse for dry mouth is a mouth rinse called Biotene. 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 It's available at Walmart, CVS. Yeah, you can buy it at any dental aisle. Biotene has been around for a very long time. That's the best for a dry mouth.
Oh, good.
Yeah.
Thank you, sir. What is the best?
Yes.
I generally brush my teeth in the evening. I mean before bed.
Yes.
Side effect.
But in the morning I don't. I simply clean my teeth with my fingers in the morning.
Okay.
So how does it matter to my health?
Again, so brushing twice a day has been recommended for a long time. You just using your finger is really not getting in and properly removing some plaque or bacteria that's been sitting on your teeth overnight. So you want to use a toothbrush also in the morning. Yes, for sure.
Every once in a while, I use water pick
Okay. Yeah.
and for flossing.
Yes. Yeah.
Nowadays, I'm not using it because I think my other up here, so I'm getting swelling and all that. So is it okay to do that or not? I have a water pick sitting at home.
Yeah, so
I'm not using
water
it.
pick is a unit. Does everyone know what a water pick is?
Yeah, I know.
Water pick is a unit that you can buy. You fill water inside it, you plug it in, and it
And
comes
put
with a
some
little stream.
mouthwash in it too.
Yeah, you can put some mouthwash in there.
Right.
And then it shoots like a jet stream of water. See,
Right.
it tickles and you might seem like
Feels good.
it splashes everywhere, but it's very good.
Right.
Because the floss that we use to remove the plaque in between your teeth, at this age, that our teeth have moved. There's so much space now. So imagine you have this big of a space, and you're taking this thin little floss. It's not going to get it out all the time.
Right.
So the water pick is a good option of just flushing water through and cleaning in between. So I would probably recommend going back
Okay.
using the water pick.
Okay.
If you're having some swelling, there's something underlying that's going on. We talked about inflammation and gum disease, so you might
Right.
want to get that checked.
I have one more question.
Mouth sores. Yeah. I'm glad you brought that up. Real quick, I didn't talk about oral cancer. Oral cancer is on the rise, right? Most people don't pay attention to it because it's inside the mouth. It might be not, it probably doesn't hurt or something like that. But it's very interesting that in my studies, I had learned while I was in dental school that betel nut is one of the causes of oral cancer.
Chalia.
Yes.
Chalia. Supyari.
Yeah.
Betel nut is chalia. And, yeah, like the ban and stuff, right? And we're all used to eating that growing up, right? Ban and chalia. That is one of the causes of oral cancer. Alhamdulillah, it doesn't affect most people, but I've seen sores in most patients' mouth. They don't know what it is. And I start questioning them. They would eat a lot of ban and that white stuff that they would put
Tuna.
in there.
Tuna.
Yes, and chalia inside, and and they would develop later on, 30, 40, 50 years later, they would have some sores in their mouth.
So her question.
I am cancer patient.
Okay, you are. Okay, so you've had sores in your mouth?
No, I think she's had, if
She
I can
did-
help, she's had a different cancer, but then she's had therapy and stuff.
Okay.
And then I think the aftermath of that is she has a sore tongue. and
Yes,
mouth.
yes, with the chemo and radiation.
Yeah, so
Yes.
that's the
Yes.
question. So she needs relief from that, I think. That's
Okay,
the
yeah, I can see. This Oracare mouth rinse is good for that too, to help relieve sores in your mouth. You've had, treatment for your cancer, and so that causes, from radiation and chemo, also has a huge effect in the mouth. Most patients don't know that it causes, your bone to deteriorate and all that other stuff, so. Any other questions?
Pan and tuna are good for teeth.
Just said no.
No, I think we just discussed that, yeah.
That is from Arizona.
Yeah. So, alright guys, I mean, did you
Yeah,
want me
so-
to touch on anything else?
Yeah, I think so most of them, they have Medicaid insurance, so they are interested
Okay,
coming
so,
to you.
someone asked me about insurance earlier.
Yes.
So Medicaid and Medicare, obviously, if you guys understand the two, they're different, right? Medicare is actually a better plan. We actually accept some Medicare plans in our office. I think like Humana, Blue Cross Blue Shield, if you have Medicare through them, they have a dental part. Medicaid, on the other hand, I don't accept it in my office, but if you just have Medicaid, then you have to go to a Medicaid office. Those are usually, if you know how the system runs, they're usually not the best care facilities, and they might have a backlog, and so unfortunately, that's the way it's run, and so I don't accept Medicaid, but we do take some Medicare plans. Yeah.
So
So-
Blue Cross Community? United Health.
Yes. PPOs, all PPOs I take, except if you have a PPO insurance plan or a dental plan that has a PPO,
Yeah.
Cigna, MetLife, UHC, whatever, etc. we accept that in the office.
So for PPO, you have to go to see the doctor first and they will give you the referral and then.
So if I accept PPO, you come straight to me, you don't have to go anywhere else.
आपको डॉक्टर के पास चले जाना
Yeah.
पड़ेगा
PPO.
So.
Can we get your card?
Yeah, I have bags for everybody, even the staff.
Can we start distributing?
Yeah, if they want to
Thank
go.
you for your time.
Yeah.
Thank you very much, Dr. Mohsin. Thank you very much.
Thank you so much for having me.
Very good. Thank you very much, Mr. Ravi.
Yeah. We'll take some. Is that sure? Yes, we make that in our